Enterobacteriaceae. Enterobacteriaceae, group of organisms of gram-negative enteric rods, normally found in gastrointestinal tract, and these organisms are facultative anaerobes, and they always has lipopolysaccharides because they are gram-negative organisms, and this lipopolysaccharide LPS is antigenic and they can act as endotoxin. And in this Enterobacteriaceae group, organisms belongs to diverse taxonomic groups, and this Enterobacteriaceae group of organisms causes disease in the GI tract, and some of these organisms, even though they are present in GI tract, they can cause infections out of GI tract or on outer part of the GI tract, extraintestinal infections, or some group of organisms they can cause infection in GI tract as well as in extra intestinal areas, and these organisms are oxidase negative and they are non-spore forming organisms. Enterobacteriaceae classification. So here in this classification we are considering major pathogenic organism to humans. This classification we can do by lactose fermenting nature. Lactose fermenters, we have two important organisms, that is Escherichia coli, which is a motile organism, and the next organism in lactose fermenters is Klebsiella organisms, especially the Klebsiella pneumoniae is a major pathogenic organisms, and these are non-motile. Klebsiella pneumoniae are non-motile. And non-lactose fermenters, which won't ferment lactose, in Enterobacteriaceae group are subdivided into two groups: the organisms which are motile and H2S producing organisms are, there are two important organisms in this group, Salmonella and Proteus, and other subgroup is non-motile and non-H2S producing organisms, that is Shigella and Yersinia. So these are the major 6 organisms in the Enterobacteriaceae group which is most pathogenic, and there are a lot more other organisms which are pathogenic, but very rarely we can see those infections like Enterobacter, etc. Escherichia coli. We can call this Escherichia coli as E.Coli. According to Burgess classification, this organism kingdom, bacteria, phylum Proteobacteria, class Gamma Proteobacteria, order Enterobacteriales, family Enterobacteriaceae, genus Escherichia, species E.Coli, Escherichia coli. These are gram-negative rods, facultative anaerobes, and when compared with the bacteroid species in the GI tract, these E. colis will normally 20:1 organisms. That means bacteroid species are more abundantly seen in human GI tract when compared to E. colis. And these organisms has 3 important antigens: O antigen, H antigen and K antigens. O antigens refers to outer membrane, H antigens refers to flagellar antigen, and K refers to capsular antigen. And these antigens will have, depending upon these antigens, we have almost 700 serotypes of E. colis. And these are oxidase negative and catalase positive organisms. And these E. colis can ferment glucose, they can ferment lactose, and they can produce energy by reducing nitrates to nitrites. And these organisms can be grown in specific media, differential media, that is Mekansky's agar. Mekansky's agar is normally used for lactose fermenting organisms to differentiate between lactose and non-lactose fermenters. And lactose fermenting organisms on Mekansky's agar grows as pink color colonies. And there is one more important medium where we can culture E. colis and other enteric rods, that is eosin methylene blue agar. And in this eosin methylene blue agar, these organisms can grow as metallic shine colonies. Virulent factors of E. coli, Escherichia coli. They have pyelonephritis associated pili, that is, we can call it as P. pili, and this P. pili containing serotypes of E. coli always binds to galactose disaccharide receptors on urinary tract epithelium, and these P. pili producing genes are always present in plasmids inside this E. coli, and these P. pili always plays a major virulent factor in causing urinary tract infections. E. coli is one of the important organisms which commonly causes urinary tract infections, especially in females, because this P. pili always can bind to galactose disaccharide receptors, which is normally seen in 90% of humans, especially in females. And this organism also has one more variety of pili, that is type 1 pili, and this type 1 pili always can bind to D-mannose receptors, which are always seen on epithelial cells of humans. And another type of pilis it can consist of is CFA or BFA. CFA refers to colonizing factor antigen, or BFA refers to bundle forming antigens. They are nothing but the group of fimbriates or pilis which helps in attaching to the enterocytes are called as colonizing factor antigens or bundle forming pilis, and there are a lot of pilis are seen on this E. coli which helps in attachment to the enterocytes, are called as colonizing factor antigens or bundle forming antigens. And we can also see another variety of non-fimbrial molecules or adhesins on the surface of this E. coli, especially after attachment, that is intimin. These intimin molecules are always secreted after attachment, especially for the strains of enteropathogenic E. coli and enterohemorrhagic E. coli. This intimin plays a major role in causing attaching and effacing lesions that leads to cause diarrhea in enteropathogenic and enterohemorrhagic E. coli strains. And these organisms always have siderophores, which helps in iron absorption. These organisms have K antigens, that is capsular antigens, especially the K1 capsule always plays a major role in causing neonatal meningitis. These capsules always inhibits antibodies and complements attachment to these bacterial surfaces, so that they can inhibit phagocytosis, decreases phagocytosis or inhibits phagocytosis. They have O antigen, outer membrane antigen. This outer membrane antigen is antigenic in nature, so you can see antibodies against this, and it can also act as endotoxin for these organisms. And these organisms has flagellas, peritricate flagellar organism. So the flagellar antigens are referred as H antigens, and they help in motility and invasive infections, invasiveness for this organism. And depending upon these three antigen K, O and H antigens, we have almost 700 plus serotypes of E. coli. And these organisms can secrete alpha hemolysin, which can act as an exotoxin even, and these alpha hemolysin can make a pore on the membranes of the host cells, and by making pores it can destruct the human cells. So majority of the human mammalian cells can get damaged because of alpha hemolysins. So alpha hemolysins are toxic to many mammalian cells, and this alpha hemolysins majorly can damage lymphocytes, and they can inhibit phagocytosis, chemotaxis of neutrophils, and they can act as beta hemolysins even. It can secrete three varieties of exotoxin. The first one is heat labile enterotoxin, which can be referred as LT, and this heat labile enterotoxin has similar functions like cholera toxin, and it is a A and B type of toxin, and this B unit always binds to ganglioside receptors on the epithelial cells of the enterocytes. Here on the right side you can see the picture, the diagrammatic representation of LT, that is heat labile enterotoxin function. The LT toxins always attaches to ganglioside receptors on the epithelial cells, especially for the enterocytes. Whenever they get attached, The B unit will attaches to the ganglioside receptors, and the A unit will get internalized, and it will activate the adenylate cyclase activity. Whenever it activates the adenylate cyclase activity, ultimately we can have increased cyclic AMPs inside the cell, which can disrupt the signal transduction for the cell, and ultimately the water molecules and a lot of electrolytes will be leaked out from the plasma membrane into the lumen, which leads to cause diarrhea. And it can secrete another two varieties of toxin. One is heat stable toxin. Heat stable toxin always binds to guanylate cyclase receptors on the apical surface of host cells, especially enterocytes, and thereby it can activate increase of cyclic AMPs inside the cell, same like heat labile enterotoxin, and ultimately there is a lot of leakage of fluid from the cells into the lumen, which ultimately can lead to cause diarrhea. And these heat stable toxins are resistant to boiling up to 30 degrees centigrade temperatures, whereas heat labile enterotoxin will be deactivated in presence of temperature. And it can secrete one more variety of toxin called Shiga toxin. This Shiga toxin is referred as Shiga-like toxin even, and the other name for Shiga-like toxin is virotoxin. And these Shiga-like toxins are always produced by a serotype of E. coli called O157 and H7 serotype, and this serotype always secretes Shiga toxin, and this Shiga toxin inhibits protein synthesis by cleaving 28S ribosomes. So this Shiga-like toxins always leads to a complication called Huss syndrome, that is hemolytic uremic syndrome, where we can see microangiopathic hemolytic anemia, thrombocytopenic purpura, and renal failure in these cases. Especially the children and LL people will get affected. And this O157 and H7 serotype majorly transmits to humans from bovine origin by eating improperly cooked beef meat or cheese or unpasteurized milk. The humans will get affected, especially the children and adult individuals. Epidemiology. These organisms will get colonized into the human's GI tract immediately after the birth, 40 hours after the birth. And there are, as already we discussed, 700 serotypes of E. coli are present based upon O, H and K antigens. And when compared to bacteroids, and these bacteroids are majorly seen inside the GI tract when compared to E. coli, so their ratio will be bacteroids is to E. coli ratio will be 20:1. And these E. coli are the most common cause of urinary tract infections, especially in females, and that high incidence you can see it in pregnant women. And E. coli is the second most common cause of neonatal meningitis according to CDC, and it's a leading cause of infantile diarrhea in developing countries, especially in hospitals and daycare centers, or people or the babies who are feeding with contaminated feeding bottles. We can see high incidence rate of diarrhea. The number one cause of the infantile diarrhea is rotavirus, and this is the second most common cause of infantile diarrhea. The transmission route majorly for UTIs, it is through intestinal tract, especially in the females. They will have a short urethra. Because of having a small or short urethra, there is a high incidence rate of this E. coli which are present in the GI tract, can easily get contaminated to the urethral regions and can lead to cause urinary tract infections through perineal areas. And the neonatal meningitis is from birth canal, majorly from mother to baby to during normal deliveries through birth canal. And intestinal diseases is majorly because of orophycal route, by contaminated water or contaminated food. The intestinal diseases will be seen in humans. Pathogenic E. coli, extraintestinal diseases causing E. coli which can cause infections are urinary tract infections, neonatal meningitis, pneumonia, septicemia, whereas intestinal disease causing E. coli there are 5 strains which can cause intestinal diseases. Those are represented here as EHEC enterotoxigenic E. coli, enteropathogenic E. coli, second one. Third one is enteroinvasive E. coli. I refers to invasive E. coli. Fourth one is enteroaggregative E. coli, and the last one is enterohemorrhagic E. coli. So here is the animated version of urinary tract pathogenesis, and this is the rectum. This box is referred as a rectum, and inside the rectum always you can have in the GI tract, you can have the E. coli which are represented as a red colored one, and for this E. coli the black colored lines which are represented on their surface refers to type 1 pili, and these red colored dots are represents with P. pili. So the organisms enters into the urinary tract, urethra, and goes to the GI, goes to the kidneys, and can lead to cause pyelonephritis. So here we can see the diagrammatic representation, and here in this left side diagram, this is the urinary bladder, my arrow pointing one, cursor pointing one, urinary bladder, and this is the ureter, and ureter is connected with kidney here. And behind this ureter, we see in the lower end, this is the perineal area, and this is the rectum. Normally these organisms are seen in the GI tract, and whenever they from the GI tract they can attach to the perineal areas. So here on the right side, if you go to this right side, right, so here you can see the perineal radius with the epithelial cells, and this is the urinary bladder, and there is the short urethra. And whenever this organisms comes out, they will attach to this epithelial tissue in the perineal areas with the help of type 1 pili. So because of instrumentation, because of intercourse, because of any contamination, or because of instrumentation, or using intravaginal contraceptives, there is a high chance of this E. coli will be introduced into the urethral areas. Whenever they are introduced into the urethral areas, they will attach to the epithelium with the help of type 1 pili, and they can attach to the epithelium with the help of P. pili even. So the organisms which can have a P. pili can always goes and binds with the red color dots here represents P. pili, and the black color lines represents type 1 pili. So this P. pili can always binds to galactose disaccharide receptors, which are normally seen on urinary tract epithelium of majorly in human beings. So whenever they attaches to this galactose disaccharide receptors, always they will have a high affinity in attachment. So whenever during micturition, majority of the E. coli which has P. pili, they won't get flushed out. Whereas the E. coli with type 1 pili which won't have P. pili, they will get flushed out majority of the time. Whenever the bladder contracts, the organisms which won't have P. pili, they will get flushed out during micturition. So the organism which has P. pili always attaches to the galactose disaccharide receptors, and they firmly attaches to the epithelium. Whenever they firmly attaches to the epithelium, they always can secrete alpha hemolysins, and these alpha hemolysins can destruct the epitheliums, and they can cause necrosis of the epithelial tissues, which can ultimately leads to cause urinary tract infection or cystitis. And these organisms, because they have a flagella, they have high access, they can have a chance of entering into the ureter, and from ureter they can enter into the kidneys, where they can cause an abscess and inflammation of the kidneys, which we can lead to cause a pyelonephritis condition. So here we can see the pathogenesis of intestinal E. coli for diagrammatic representation. There are 5 strains of E. coli: enterotoxigenic E. coli, enteroinvasive E. coli, enteropathogenic E. coli, enterohemorrhagic, and enteroaggregative E. coli. 5 varieties of E. coli. So first, enterotoxigenic E. coli, they will enter into the GI tract. Whenever they enters into the GI tract, by escaping from the stomach acidity, for escaping from stomach acidity, they require a high dose of organisms. Almost thousands of organisms are required to cause an infection. Whenever they enters into the GI tract, they will attach to the small intestine enterocytes with the help of bundle forming villi or colonizing factor antigen. After attachment, they will release this LT, the seat labile toxin, and stable toxin. So ultimately, they will lead to cause diarrhea in the GI tract, diarrhea in the humans. Whereas in enteroinvasive E. coli, they always comes and attaches to the intestinal epithelium, but we don't know the exact virulent factors which can lead to cause the infection in the GI tract. But the outer membrane proteins may play a major role in causing infection, and this enteroinvasive E. coli always enters into the cell and replicates inside the cell and destruct the cells. So always you can see an inflammatory type of diarrhea, an invasive type of diarrhea. You can see it in invasive enteroinvasive E. coli, whereas in enterotoxigenic E. coli always causes non-inflammatory diarrhea. That means you can't see any fever, only we can see watery diarrhea. Whereas invasive E. coli, we can see bleeding, we can see pus in the stools and mucus in the stools, because they are invasive in nature, but we don't know the exact virulent factors, and we don't know the exact mechanism how they can cause the infection. And enteropathogenic E. coli always enters into the GI tract and attaches to the epithelial cells, enterocytes, with the help of bundle forming villi or colonizing factor antigen. After attachment, they will secrete this E. coli secretory proteins into the cells by type 3 secretory process mechanism. They will inject the proteins, E. coli secretory proteins, into the cytoplasm of the cell. So we can see a conformational change. The TIR receptors, that is translocating intermin receptors, are injected, and this intermin receptors always comes and expresses outside of the host cell plasma membrane. At that point of time, the intermin, which is present on the cell membrane of this E. coli cell membrane, they will always goes and attaches to that translocating intermin receptor, TIR receptors, so that these cytoskeletal filaments, especially the actin molecules, will get polymerized and changes the microvilli structures, and that can lead to cause attaching and effacing lesions. We can see the exact animatory picture how it happens in the next slide. So because of having this attachment and effacing lesions, they can lead to cause diarrhea, because the microvilli will get altered their shape, so the surface area will be disturbed, and we can see the diarrheal symptoms in these infections, in enteropathogenic E. coli infections. And we will see non-inflammatory and non-invasive type of diarrhea. That means we can't see any pus or blood or fever in these patients. And the next variety is enterohemorrhagic E. coli. These enterohemorrhagic E. coli attaches to the epithelial cells, enterocytes, with the help of bundle forming villi, and after attachment they will secrete this E. coli secretory proteins through type 3 secretory process into the host cells, and after secreting, the intermin attaches to this, the secretory TIR receptor, translocating intermin receptors. After attaching to the TIR receptors, we can start to see A and E type of lesion, attaching and effacing lesions here also in enterohemorrhagic E. coli. At that point of time, this enterohemorrhagic E. coli can secrete one exotoxin called Shiga toxin, especially the serotype O157 and H7 serotype secretes the Shiga toxin. Whenever this Shiga toxin is secreted, the protein synthesis will be inhibited, and whenever the Shiga toxin enters into the bloodstream, it can damage the blood vessels, it can damage the capillary, it can damage the red blood cells, it can damage the renal tissues, which can ultimately leads to hemolytic microangiopathic hemolytic anemia and thrombocytopenic purpura and renal failure, which we can call it as Huss syndrome, major complication because of Shiga toxin release. And the last variety is enteroaggregative E. coli. We don't know the exact virulent factors for for this enteroaggregative E. coli, but there is a hypothesis that this organism can secrete stable toxin and hemolysins, but we don't know the exact mechanism of these two virulent factors. And these organisms, majority of the time, they will attach to the enterocytes with the help of bundle forming pili, and they can make a biofilm. So by making the biofilm, they can alters this actin filaments, and they can lead to cause the diarrhea. Always you can see a persistent diarrhea, continuous persistent diarrhea because of aggregative E. coli, but we don't know the exact pathogenic mechanisms. But we always see during the infection, we can see the biofilm formation because of aggregative E. coli. Here we can see a short video of E. coli pathogenesis. First we'll see the left side one. The E. coli is coming, and these are the microvilli. It enters into the GI tract, into the small intestine, attaching to the enterocytes microvilli. And once it attaches, normally it will attach with the help of pili, which is not shown in this animation, but it will attach with the help of pili. Once it attaches to the pili, the type 3 secretory mechanism, like a syringe, it will inject, it will make a syringe like protrusion structure, and after making this syringe like structure, type 3 secretory proteins are organized like this, and they will inject the E. coli secretory proteins, ESPs, and these ESPs are nothing but TAR receptors, that is translocating intermin receptors. Once these receptors are formed, they will be expressed outside of the host cell membrane like this, host cell membrane. So when we go up and on top of this plasma membrane, they appear like this. Whenever they get expressed TAR receptors, the intermin molecules, which are represented as blue here, they will attach to the TAR receptors. Once they attaches to the TAR receptors, the actin molecules, there will be a conformational change here for this TAR receptors. So for this TAR receptors, the actin polymerization occurs. The actin molecules are organized in the form of filaments, elongated filamental structures, the actin molecules. So they are very much elongated, like very thick strands. So once these strands are formed, the plasma membrane of the host cell will be elevated. We can see on the top, once it is formed, the plasma membrane will be elevated like a dome, where this E. coli can sit on top of this. So by making this change in the plasma membrane of the host cell enterocytes, the surface area for absorption will be disturbed. So by disturbing the surface area of the plasma of the enterocytes, it can ultimately reduce the absorption, that can ultimately leads to cause diarrhea. So here on the right side we can see one more animation, especially this left side video what we saw. Always you can see that attaching and effacing lesions, especially we can see one more time, I'll show you. This is attaching and effacing lesion. This projection where we have this E. coli and plasma membrane projection, this is what the attaching A and E lesion, attaching and effacing lesion, that can change the surface area, so the absorption will be decreased and we can see diarrhea. We can see that conditions, especially that kind of pathogenesis in enteropathogenic E. coli and enterohemorrhagic E. coli, we can see that pattern of pathogenesis. Here we can see one more animation. So enteropathogenic and non-pathogenic E. coli. first we will see enterotoxigenic E. coli pathogenesis. E. coli came here, attaches to the enterocytes, Whenever it attaches, with the help of bundle forming pili or colonizing factor antigens, so after attachment it secretes the LT and ST toxins, heat labile toxin and heat stable toxin. Whenever it secretes, there will be a fluid loss into the lumen, which can lead to cause diarrhea. Now we can observe one more variety of E. coli strain, that is enterohemorrhagic E. coli. This is enterohemorrhagic E. coli, enters into the GI tract and it attaches to the epithelium with the help of bundle forming pili and intimin, and after attachment it releases the Shiga toxin. This is the pedestals. This is the one which we'll call it as attaching and effacing lesions by altering the actin filaments, and after that it secretes the Shiga toxin. So the Shiga toxin will damage or decreases or inhibits the protein synthesis, and which can ultimately destructs the cells. So clinical conditions: extraintestinal infections, that is urinary tract. The most common cause of urinary tract infection is E. coli, and especially the strains uropathogenic E. coli strains can cause UTI infections, which can produce PPLs. Especially uropathogenic E. coli can produce PPLs because they always carries a plasmid which have a gene that can help in production of PPLs, and 90% of UTIs can occur by E. colis, and higher incidence we can see it in pregnant women. And during this infection we can see patients suffering with dysuria, pain during urination, lower abdominal pain, increased discharges, and we can see urinary bladder infection. So because of urinary bladder infection you can see increased frequency of urination, and the people who are suffering with this UTIs because of E. coli, they can also have dyspareunia, pain during sexual intercourse, and if it is untreated it can lead to cause pyelonephritis. That means these organisms spreads to the kidneys, and where we can see septicemia and inflammation of kidneys. We can see fever in those cases, dysuria, radiating back pain, and we can see tenderness at costovertebral angle in the back. And if it is untreated, the patients can lead to have a shock condition, because these organisms, whenever they enters into the blood circulation, they are gram negative. They have an endotoxin, can damage the epithelial cells, endothelial cells, which can ultimately lead to shock condition. And these organisms can cause neonatal meningitis. It is the second most common cause of neonatal meningitis, and the transmission is mainly through birth canal. And the virulent factor for causing neonatal meningitis is K1 capsular antigen. And during this condition we can see fever, irritability, constipation, poor feeding, bulging frontanella, seizures in the babies. And these organisms can cause neonatal pneumonia, especially whenever the babies are delivered for an infected mother. If the secretions enters into the respiratory tract of the baby, they can get pneumonia, where we can see fever, chills, and the babies will have a cough with sputum, and in x-rays we can see consolidation and infiltrations. And if this organism enters into the bloodstream, there is a high chances of septicemia, because these organisms can secrete or produce endotoxins. Intestinal diseases: enterotoxigenic E. coli strains, we can call it as EHEC. These enterotoxigenic E. coli strains can cause travelers diarrhea or infantile diarrheas, normally seen in infant and travelers to underdeveloped countries or regions of poor sanitation. In US, outbreaks by water, cheese, Mexican style food ingestion, or by raw vegetables. So the infective loads for this enterotoxigenic E. coli will be very large. It increase more infective dose, that is 10 to the power of 8. And after having these organisms, the onset of symptoms occurs within 1 or 2 days. The major virulent factors in causing enterotoxigenic E. coli travelers diarrhea or the diarrheal symptoms is majorly because of colonizing factor antigen, heat labile toxin, and stable toxin. And we can see a watery diarrhea, and this diarrhea will always similar to cholera like syndrome, cholera like symptoms. And this diarrhea is non-inflammatory, non-invasive, and it is self-limiting majority of the times. Adults who always get this infection, who lives in endemic areas, they normally get immunity against this enterotoxigenic E. coli, where in their bodies they will have antibodies against the LT toxin, heat labile toxin, which can inhibit the enterotoxigenic E. coli diarrhea. Enteropathogenic E. coli, EPEC. So 20% of diarrhea in bottle fed infants, because this enteropathogenic E. coli is always can transmit to the babies because of poor feeding bottles, unsterile feeding bottles, or from hospitals, or by contaminated association with the visitors and family members can lead to get this infection for the babies below 1 year, and is the second most common cause of infant diarrhea after rotavirus. And transmission mainly by fomites, drinking water, meat products, daycares, hospitals, and infecting dose for infants is very low. And virulent factors for enteropathogenic E. coli is intermin is the main virulent factor, because always this organisms enteropathogenic E. coli always they have a type 3 secretory system where they can inject E. coli secretory proteins, which can consist of major important protein is TAR, translocated intermin receptors. So this receptors are injected into the host cell, so where this intermin will go and attaches, and after this attachment you can start to see attaching and effacing lesions. Here in the right side you can see attaching and effacing lesion. This is the enterocyte, this is the microvilli. So whenever this intermin is attached with the help of TAR receptors and E. coli secretory proteins, the plasma membrane of the host cell will be protruded, and it will created like a pedestals, like attaching and effacing type of lesions. So by altering this microvilli structure, the surface area of the enterocytes, it will decrease or inhibits the absorptive capacity of the GI tract enterocytes, which can ultimately lead to cause the diarrhea. So the diarrhea in enteropathogenic E. coli is non-invasive and a non-inflammatory type of diarrhea. And the symptoms, it is normal watery diarrhea. So here is the diagrammatic representation of enteropathogenic E. coli. So this is the intestinal enterocyte, and these are the E. coli, enteropathogenic E. coli. First they came here, attaches, and by type 3 secretion they injected this secretory proteins and TAR receptors, and this TAR receptors here, if you go to the right side, this is the type 3 secretory injection canal. So this proteins and TAR receptors are injected into the host cell, and this TAR receptors goes and attaches to the plasma membrane and expressed outside to the plasma membrane. Whenever it get expressed TAR receptors, right, this intermin will goes and attaches to this TAR receptors. Whenever it is attaches to the TAR receptors, there will be a conformational change for the TAR receptors, so that the actin molecules will get polymerized and they can make like a change. Whenever they can make like a change, the plasma membrane of the host cell will get protruded like with the help of pedestal like protrusions with the help of actin molecules, and we can see the attaching and effacing type of lesion. This is the effacing pedestal type of lesion. So that means the microvilli are suppressed here, the surface tension or the surface area of microvilli are decreased here, so that there is a lack of absorption into the cells. Not only that, this E. coli secretory proteins and TAR receptors, they can also break this tight junctions in between the cells, so the interstitial fluid which is present in the below the lamina propria will be excreted out, so that the diarrhea will be increased. And one more thing it can do is it can lead to cause apoptosis of the cells. Even the cells at one point of time they will be destructed, especially you can see this apoptosis in enterohemorrhagic E. coli. This E. coli secretory proteins can lead to cause apoptosis even. Enterohemorrhagic E. coli, they can cause hemorrhagic colitis or bloody diarrhea, and the main serotype which can cause the majorly enterohemorrhagic E. coli infections is O157 and H7 serotype. And the reservoir for this enterohemorrhagic E. coli strains are mainly from cattle, beef products, lettuce, sprouts, fruit juices, and unpasteurized milk. And there is a low infectant dose for this enterohemorrhagic E. coli. 10 or 100 organisms are sufficient to cause infection. And the main virulent factor for enterohemorrhagic E. coli is intimin and Shiga-like toxin or virotoxin. There are two varieties of Shiga-like toxin, Shiga-like toxin 1 and 2. Symptoms in enterohemorrhagic E. coli infections, we can see watery diarrhea, starts with watery diarrhea with severe cramps, and that can progress to bloody diarrhea. And we can see fever in a milder as a milder symptom with the minimal fever, or sometimes we can't see fever in these patients even. So the complications, if it is untreated, majorly hemolytic uremic syndrome, which includes three conditions, three signs, that is thrombotic thrombocytopenic purpura, renal failure, and microangiopathic hemolytic anemia. Especially this Huss syndrome is mainly caused by Shiga-like toxin. Whenever the Shiga-like toxin enters into the bloodstream, that can cause damage to the blood vessels, that can cause damage to the red blood cells, and ultimately renal failure occurs. This Huss syndrome is approximately seen in 5 to 10% of the individuals, and by using antibiotics may increase this secretion of Shiga-like toxin. So that's why the antibiotic usage has to be decreased or has to be prevented in enterohemorrhagic E. coli infections. Antibiotic usage can increase the Shiga toxin production. So here we can see the diagrammatic representation of the pathogenesis. Here in this picture, this is the enterocytes, and these are the E. coli, enterohemorrhagic E. coli. They are attached with the help of intimin. Same excretory E. coli excretory proteins will be secreted first, and afterwards intimin will get attached, and you are seeing attaching and effacing type of lesion. And after that they secrete the Shiga toxin. This Shiga toxin can damage the epithelial cells, and they can enters into the blood vessels by damaging the epithelial cells. Once they enters into the red bloodstream, they can damage the RBCs, they can destruct the RBCs, and by destructing the RBCs, majority of the platelets will get accumulated, which can lead to thrombocytopenic purpura, and ultimately we can see the destruction of the endothelial cells, and we can see intravascular coagulation, and this Shiga toxin is more toxic to the renal tissues. Here you can see the Shiga-like toxin enters into the cells, and it disrupts the 28 ribosomes, and by cleaving this 28 ribosomes, it inhibits protein synthesis. So whenever there is a lack of protein synthesis, ultimately the cells will get destructed and cells will get died. Enteroinvasive E. coli, and in this enteroinvasive E. coli, the infection is similar, the infection pathogenesis, and we don't know the exact pathogenic mechanism in virulent factors. The infection is similar to Shigella dysentery infection, shigellosis infection. You can see increased number of incidents in above 5 years age group, and the major route of this enteroinvasive E. coli infections is by orophycal route, and these organisms lack fimbria like adhesins and the LT and ST toxins, but they can have outer membrane protein. We don't know the exact mechanism of this outer membrane proteins in causing enteroinvasive E. coli infections, and these enteroinvasive E. coli infections are always inflammatory and invasive because these organisms enters into the cells and destructs the cells, so it can lead to cause inflammation. So you can see fever in these patients, you can see leukocytes in the blood in the feces. So it is called as inflammatory and invasive type of diarrhea, dysentery condition, and you can see diarrhea with blood and pus dysentery with severe inflammation and fever in this condition. And there is a last variety of entero E. coli, that is enteroaggregative E. coli. And in this enteroaggregative E. coli infections, we can see persistent diarrhea, especially in young children, and we can't see any inflammation, non-inflammatory and non-invasive type. And these organisms always can make a biofilm, and these organisms has a hypothesis that they can produce stable toxin, stable toxin and hemolysis, but we don't know the exact function of these two virulent factors which are secreted by these organisms. Diagnosis: extraintestinal infections, especially the specimens, can be taken from bladder or from CSF, and we can culture these organisms on Mekansky's agar and ENB agar, and we can also diagnose this organism with the help of serological tests by identifying the exact serotype depending upon O, H and K antigen serotypes. And these organisms can also be cultured with ENB agar, where we can see metallic shine colonies on ENB agar, eosin methylene blue agar. Intestinal infections we can diagnose with the help of culture on Mekansky's agar and ENB agar. These organisms in Mekansky's agar grows as pink color colonies, whereas ENB agar they can grow as metallic shine colonies. And normally the E. coli can ferment sorbitol. So in sorbitol containing Mekansky's agar, majority of the E. coli can grow, whereas enterohemorrhagic E. coli can't ferment sorbitol. So enterohemorrhagic E. coli always can be diagnosed by culturing on Mekansky's sorbitol Mekansky's agar. So on that agar there won't be any growth. So that's how we can diagnose enterohemorrhagic E. coli. And other tests we can do is oxidase negative. These organisms are oxidase negative, and they are positive for leukocyte esterases, and they can change nitrates to nitrites. So with all these diagnostic techniques, we can diagnose these organisms, E. coli organisms. Treatment for extraintestinal infections, for UTIs especially, we can use ciprofloxacin, trimethoprim, or we can use sulfamethoxazole. For meningitis, for babies, neonates, cephalosporins are the best drugs. For intestinal infections, first we need to give rehydration and supportive measures to increase the fluid levels in the human body. And we can also give trimethoprim antibiotics. We can use as trimethoprim or sulfamethoxazole, especially for enterotoxigenic E. coli, enteropathogenic E. coli and enteroinvasive E. coli, to reduce the duration of infections. Majority of the time enterotoxigenic E. coli is self-limiting disorder, whereas enteropathogenic and enteroinvasive E. coli we can use this trimethoprim or sulfamethoxazole. For enterohemorrhagic E. coli, we can always give hemodialysis or hemopharesis, and we shouldn't give for enterohemorrhagic E. coli, we shouldn't give anti-motility drugs. We must inhibit the anti-motility drugs are contraindicated because they can aggravate the condition enterohemorrhagic E. coli conditions. Klebsiella pneumoniae. The next lactose fermenter in Enterobacteriaceae Klebsiella is the genus and the pneumoniae is the species. So according to Burgess classification, Klebsiella organisms comes under the kingdom Bacteriae, phylum Proteobacteriae, class Gamma Proteobacteriae, order Enterobacteriales, family Enterobacteriaceae, genus Klebsiella, and the species which is most important for medically important species is Klebsiella pneumoniae. These organisms are gram-negative. These are gram-negative rods, rod-shaped bacteriums, non-motile and oxidase-negative organisms, lactose-fermenting, facultative anaerobes, found normally in mouth, skin, and intestine floras. These organisms have a thick capsule made up of a polysaccharide, and because this capsule is very thick and viscid in nature, it can also be sometimes called as slime layer. And the virulent factors for these organisms is capsule and endotoxin. Susceptible patients are ventilator associated pneumonia patients in hospitals, alcoholic and diabetic patients, immune compromised patients, and catheter using patients are more susceptible to get these infections, Klebsiella pneumonia infections. It can cause pneumonia, meningitis, and UTIs, urinary tract infections. And we can always see in pneumonias, we can see a thick bloody sputum is one of the major diagnostic feature because of thick capsule. And the diagnosis, we can diagnose with culture and serology. For identifying this capsule, by using antibodies we can identify the capsule, and by culturing on Mekansky agar we can grow these organisms and identify. And the treatment, we can use cephalosporins like cephaloxivins, or we can use fluoroquinolones to treat these patients.